Subscribe for daily quizzes and let me know how many you got correct today. Here's some Hematology Basics trivia. What type of cell carries oxygen in blood? A. Neuron or B. White blood cell or C. Platelet or D. Red blood cell? The correct answer is D. Red blood cell. What protein is primarily responsible for oxygen transport? A. Myoglobin or B. Collagen or C. Hemoglobin or D. Albumin? The correct answer is C. Hemoglobin. What is the normal range of white blood cells per microliter? A. 4,000 or 11,000, B. 2,000 or 5,000, C. 8,000 or 20,000, D. 12,000 or 15,000. The correct answer is A. 4,000 to 11,000. What type of blood cell is involved in immune response? A. Platelet or B. White blood cell or C. Neuron or D. Red blood cell? The correct answer is B. White blood cell. What is the liquid component of blood called? A. Plasma or B. Serum or C. Platelets or D. Hemoglobin? The correct answer is A. Plasma. What organ produces red blood cells? A. Bone marrow or lungs or C. Spleen or D. Liver? The correct answer is A. Bone marrow. What is the condition of having too few red blood cells? A. Anemia or B. Thrombocytopenia or C. Leukemia or D. Sickle cell? The correct answer is A. Anemia. Which condition involves excessive blood loss? A. Hemorrhage or B. Hypertension or C. Anemia or D. Sepsis? The correct answer is A. Hemorrhage. What type of white blood cell fights infections? A. Leukocyte or B. Platelet or C. Red blood cell or D. Plasma cell? The correct answer is A. Leukocyte. What is the process of forming blood clots called? A. Thrombosis or B. Hemolysis or C. Hemostasis or D. Coagulation? The correct answer is D. Coagulation. What condition is characterized by high platelet counts? A. Hemophilia or B. Anemia or C. Leukopenia or D. Thrombocytosis? The correct answer is D. Thrombocytosis. What is the term for low platelet levels? A. Thrombocytopenia or B. Leukopenia or C. Anemia or D. Hemophilia? The correct answer is A. Thrombocytopenia. What type of anemia is caused by vitamin B12 deficiency? A. Iron deficiency anemia or B. Pernicious anemia or C. Aplastic anemia or D. Sickle cell anemia? The correct answer is B. Pernicious anemia. What is the primary function of platelets? A. Oxygen transport or B. Nutrient absorption or C. Hormone regulation or D. Blood clotting? The correct answer is D. Blood clotting. What test measures the speed of blood clotting? A. PT test or CBC test or C. PT test or D. ECG test? The correct answer is A. PT test. What is the name for the enzyme that digests fibrin? A. Pepsin or B. Thrombin or C. Renin or D. Plasmin? The correct answer is D. Plasmin. Which type of leukocyte is involved in allergic responses? Basophil or B. Neutrophil or C. Monocyte or D. Eosinophil? The correct answer is A. Basophil. What is the lifespan of a red blood cell? A, 7 months, or B, about 120 days, or C, 3 years, or D, 30 days? The correct answer is B, about 120 days. What condition results in the abnormal shape of red blood cells? A, thalassemia, or B, sickle cell disease, or C, leukemia, or D, hemophilia? The correct answer is B, sickle cell disease. What disease is characterized by the absence of hemoglobin? A, sickle cell anemia, or B, hemophilia, or C, iron deficiency, or D, thalassemia? The correct answer is D, thalassemia. What is the primary function of lymphocytes? A, blood clotting, or B, immune defense, or C, nutrient absorption, or D, hormone production? The correct answer is B, immune defense. What is the primary component of blood plasma? A, red blood cells, or platelets, or C, hemoglobin, or D, water? The correct answer is D, water. What is the role of the spleen in the bloodstream? A, produce insulin, or B, filter blood, or C, generate red blood cells, or D, store energy? The correct answer is B, filter blood. What inflammatory process is involved in blood vessel repair? A, angiogenesis, or B, hemostasis, or C, edema, or D, inflammation? The correct answer is B, hemostasis. What element is essential for hemoglobin production? A, magnesium, or B, calcium, or C, copper, D, iron? The correct answer is D, iron. What is the normal range of red blood cells per microliter? A, 3.0, 4.5 million, or B, 6.5, 8.0 million, or C, 4.7, 6.1 million, or D, 1.2, 2.0 million? The correct answer is C, 4.7, 6.1 million. What is the primary role of plasma proteins? A, transport substances, or B, regulate blood pressure, or C, fight infections, or D, produce energy? The correct answer is A, transport substances. What measurement indicates the oxygen carrying capacity of blood? A, hemoglobin level, or B, hematocrit, or C, plasma ratio, or D, blood volume? The correct answer is B, hematocrit. Which condition is indicated by prolonged bleeding? A, coagulation disorder, or B, infection, or C, anemia, or D, hypertension? The correct answer is A, coagulation disorder. What type of leukocyte attacks parasites? A, eosinophil, or B, basophil, or D, neutrophil? The correct answer is A, eosinophil. What is the term for blood cell formation? A, hematopoiesis or oxygenation, or C, hemolysis or coagulation? The correct answer is A, hematopoiesis. What is a common cause of iron deficiency anemia? A, poor diet, or B, vitamin D deficiency, or C, high cholesterol, or D, heavy exercise? The correct answer is A, poor diet. What condition results from the body's inability to produce clotting factors? A, thrombosis, or B, scurvy, or C, hemophilia, or D, anemia? The correct answer is C, hemophilia. What is the primary function of monocytes? Hormone secretion, or B, phagocytosis, or C, oxygen transportation, or D, antibody production? The correct answer is B, phagocytosis. What test assesses platelet function? A, bleeding time, or B, platelet count, or C, coagulation time, or D, hemoglobin level? The correct answer is A, bleeding time. What is the primary function of erythropoietin? A, increase white blood cells, or B, enhance oxygen delivery, or C, regulate blood pressure, or D, stimulate red blood cell production? The correct answer is D, stimulate red blood cell production. What process breaks down fibrin clots? A, thrombus formation, or B, hemostasis process, or C, coagulation cascade, or D, fibrinolysis? The correct answer is D, fibrinolysis. What condition involves the formation of blood clots in veins? A, clotting disease, or B, blood vessel inflammation, or C, venous thrombosis, or D, deep vein thrombosis? The correct answer is C, venous thrombosis. What disorder is characterized by the accumulation of iron? A, iron deficiency anemia, or B, celiac disease, or C, Wilson's disease, or D, hemochromatosis? The correct answer is D, hemochromatosis. What is the function of the thymus in hematology? A, store white blood cells, or B, mature T cells, or C, filter lymphatic fluid, or D, produce red blood cells? The correct answer is B, mature T cells. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.